In NBC Today show, on March 8, 2006, Katie Couric interviews 18-year-old Christy Yamoko, who tells her story of her near-fatal cheer injury. Christy was a Southern Illinois college cheerleader who fell 15 feet from a pyramid and landed on her head. Christy was a Southern Illinois college cheerleader with a head injury and cracked vertebrae and a bruised lung. Christy stated, "Although there are some dangers in cheerleading, that is a risk cheerleaders are willing to take." According to Dr. Frederick Mueller, the lead researcher of the University of North Carolina, states that college cheerleader injuries are grim, and a major factor in this increase has been the gymnastics-type stunts required of these. Sports physicians and physical therapists have developed a specific treatment for the three most common injuries suffered by college cheerleaders. So we must understand the three most common injuries and treatments for the three most common serious injuries for college cheerleaders. The first most common serious injuries is the head. According to the National Center for Catastrophic Sports Injury Research, a study from 1982 to 2002 published in the American Journal of Sports Medicine states that cheerleaders suffered more than half catastrophic injuries over this time, and 59% of those injuries were due to the head injuries. These injuries come from basket tosses, pyramids, and floor stunts. Traumatic brain injury is the most serious head injuries. Brain trauma or concussions are a result from cheerleading, falling from a stunt, and landing on their head or landing on another teammate. For example, the flyer on top is the most injured because she is being tossed 15 feet in the air. The treatment are steroids for brain swelling and sedatives and surgery for severe blood clots. The second most common serious injury is the neck. Cheerleading injuries are not as frequent as other sports, but they are more severe. For example, the United States Consumer Product Safety Commissioner estimated that cheerleading led to 16,000 emergency room visits in 2002 with neck injuries. Fractures and ligament tears are the most common serious neck injury. Fractures cause temporary and sometimes permanent spinal paralysis. Ligament tears cause severe pain and extensive rehabilitation. The treatment are physical therapy and surgery. The third most common serious injury are the extremities. First are the arms, wrists, and shoulders. These injuries are related to tumbling and which require the use of your arms and upper body strength. Cheerleaders who lift others are more prone to arm injuries. And the second are ankles and knees, which make up 20% of common injuries. According to the Center of Injury Research and Fall-Related Injuries 2009 study that nearly 90% of most serious injuries are due to doing stunts on wood floors. The treatment for the most common treatments are resting the injury for 24 hours and surgery for the arms, wrists, shoulders, ankles, and the knees. Now that we understand the three most common serious injuries of the head, the neck, and the extremities for college cheerleaders, we can be assured for the treatments available for these athletes. So we looked at the three most common serious injuries for the neck, head, and extremities. Cheerleaders are strenuous athletes, and the injuries increase. Remember Christy Yamoko's accident? The higher the stunt level, the harder the fall.